Gluteoplasty, or buttock augmentation, is an increasingly performed procedure in the United States, but in Latin America it's tremendously popular. Why is that? I think because in Latin America they understand that the buttock is an essential component of the torso and really influences the overall appearance of a woman's shape. Buttock augmentation can improve the proportionality of the patient, balance the patient's breasts, the patient's hips, and allow the patient a more pleasing figure in clothes, in bathing suits, and a more curvy and healthy look. The technique of buttock augmentation has advanced dramatically over the past decade. The technique that we use is an intrasulcal incision, an incision between the cheeks of the buttock that is almost completely hidden in repose. Through this incision, we enter each buttock and elevate the fascia, or the tough tissue covering the gluteus maximus muscle, to provide maximal soft tissue coverage of the implants. The implants we use are silicone implants, but the silicone elastomer of buttock implants is much firmer than breast implants. But covered with the patient's native breast tissue, they tend to give the patient's buttock a firm feel to the touch, but still natural because of all the soft tissue covering it. I think it's important when talking about gluteal augmentation to think about the buttock in relation to the tissues that surround it. And typically when we perform a gluteal augmentation, as part of that surgery, we're also performing liposuction of the hips, the waist, the lateral buttock, the lateral thighs, sometimes the medial thighs, really shaping the frame around the buttock, and most importantly the lower back. And as we clean this area out and shape it, just the liposuction itself begins to give the buttock more prominence and set it off. Adding an appropriately sized gluteal implant to the patient's buttock in tandem with the liposuction that we've done can really give a very nice finished look. And with the fat that we harvest, the final touches can then be applied by transferring fat to improve the shape as we need to, and can really achieve quite a harmonious look of the buttock that flows naturally from the lower back and then into the legs. And I think you'll be seeing this procedure done with increasing frequency in the United States as more and more people begin to see what nice results patients can gain from buttock augmentation and how happy they can be.